Hello doctors, welcome back to ENAMEL-HEROES. I hope you all are doing well. So today we are here with another topic, that is antibiotics. And here in this video we'll be discussing about the classification of antibiotics. So as you can see, the antibiotics are basically classified on the basis of mechanism of action. So it is divided into three groups. First is the cell wall inhibitors. Then second is the protein synthesis inhibitors. And we have third group is the DNA synthesis inhibitor. Then mycolic acid inhibitors, and then folic acid pathway inhibitors. Okay. So antibiotics on the basis of mechanism of action are basically divided into 6 categories. So here the first category is the cell wall inhibitors. There are certain antibiotics which act on the cell wall. They inhibit the cell wall of the bacteria. So here it comes beta-lactam antibiotics, and under the beta-lactam antibiotics we see penicillin, cephalosporins, monobactams, and carbapenems. Okay. In the penicillin we have penicillin G, amoxicillin, and ampicillin. And in cephalosporins we have cefixime. Monobactams we have aztreonam, and in carbapenems we have imipenem. Now come to the second category, that is the protein synthesis inhibitors. These are the antibiotics that inhibit the protein synthesis inside the bacteria. So as you know, what is the function of ribosomes? Ribosome is a structure that produces protein. So these antibiotics act on the 30th ribosomes as well as 50th ribosome. As you know, ribosome is of two types, 30th type and 50th type. So let's see the drugs which act on the 30th ribosome. First is the aminoglycosides and second is the tetracycline. In aminoglycoside we have streptomycin and gentamicin. In tetracycline we have doxycycline and minocycline. So these are the drugs, aminoglycosides and tetracyclines, which in these these are the drugs act on the 30th ribosomes. So the drugs which act on 30th ribosome we have two, that is aminoglycosides and tetracyclines. Now these are the drugs that acts on the 50th ribosome. So here we have streptogramins, macrolide, lincosamide, and chloramphenicol. So what we have inside streptogramins, we have dalfoprestin and quinoprestin combination. Streptogramin is a drug. It is basically the combination of the two drugs, that is dalfoprestin and the quinoprestin. Now we have macrolide. Inside the macrolide we have erythromycin and azithromycin. And inside linocosamide we have clindamycin. See, there are patients which are allergic to these two drugs. So we give clindamycin. This is the safest drug. We give this drug in a patient who are allergic to azithro and erythromycin. Okay. Now our third group, that is DNA synthesis inhibitors. So in DNA synthesis inhibitor, drug basically inhibit the synthesis of the DNA inside the bacteria, that is the nuclear material. So in DNA synthesis we have fluoroquinolones and metronidazole. Then we have RNA synthesis inhibitors, that is our fourth group. In RNA synthesis inhibitors we have rifampicin. Now the fifth group, that is the mycolic acid inhibitors. Inside mycolic acid inhibitors we have isoniazid. Now the sixth and the last group we have folic acid pathway inhibitors. In folic acid pathway inhibitor there comes sulfonamides, as you can see. Sulfonamides. Inside the sulfonamides we have Cotrimoxazole. Cotrimoxazole is a combination of two drugs. Which two drugs? Trimethoprim and sulfamethoxazole. And friends, this is a very important question. Star mark point. They ask in NEET also. What is the ratio of the two drugs that makes the cotrimoxazole? So basically they ask the ratio of trimethoprim and sulfamethoxazole. So this ratio is 1:5. The ratio is 1:5. Remember, this is a star point. Okay. So that's it. It is for the classification of antibiotics. And now I'll be telling you which kind of question they may ask from antibiotics. They can ask long note as well as short note about the classification of antibiotics. Okay. They can ask you individually about any antibiotic. Suppose they can ask you about cephalosporins. They can ask about the mechanism of action. They can ask about sulfonamides, plus action. So basically my point is, they can ask any antibiotics or they can ask you the classification. If any individual antibiotics comes in exam, like if they are asking sulfonamides or about penicillin G or cephalosporins or fluoroquinolones, anything. In order to score good marks, you are supposed to start the question from the classification of antibiotics. You will starting your question with the classification of antibiotics and then adding mechanism of action, about the mechanism of action of the you will be writing about the mechanism of action of the concerned antibiotic. Suppose they are asking about the cephalosporins, so you will be writing the mechanism of action of cephalosporins along with the entire classification in order to score good marks. Okay. So that's it. These are the kind of the questions that come from antibiotics, and you are supposed to write the entire classification in order to score good marks. In order to fetch good marks, you can write the entire classification. So that's it for this topic. We'll be meeting you again